fellow FODMAPers, it's Megan Marie from woodyandmarine.com, and we have a series for you all about IBS and the Low FODMAP diet. Today we're going to answer the question, what is IBS? IBS stands for Irritable Bowel Syndrome. It's a chronic gastrointestinal disorder and it causes symptoms like pain in your abdomen, bloating, gas, diarrhea, and even constipation. It's really common. It's actually the most diagnosed disorder by gastroenterologists. And your symptoms can really range from being kind of mild to absolutely debilitating, and they can change over the course of your life. Fun fact, females are actually more likely to suffer from IBS than males. Although IBS can be painful and it's a lifelong disorder, it doesn't really cause any damage to your intestines. It's not going to lead to any life-threatening conditions such as cancer. IBS can really come in waves, meaning there are times when my IBS can be worse, and this is called an IBS flare-up or an attack. During these times, people tend to lean on safer foods that kind of like calm their IBS or at least don't cause any additional symptoms. So what causes IBS? Actually, nobody really knows what the cause of IBS is, but many believe it's hereditary. And other research suggests there's actually a link between our brain and our gut. So nerves in the gut of someone with IBS are thought to be overly sensitive, sending signals to the brain that translate into pain. And some people actually develop IBS after an infection, such as gastroenteritis or bacterial overgrowth in the gut. Anxiety and depression are also linked to IBS. However, it's unclear which comes first, but it's very common for people with IBS to be diagnosed with one or both of these conditions. So during really stressful times, it's very common for someone with IBS to experience symptoms or flare-ups. So you might be thinking, do I have IBS? Like, how do I get diagnosed? Unfortunately, there's not a single test to really diagnose IBS. Instead, it's really a process of elimination. So if you want to learn if you have IBS or not, if you identify with some of these symptoms, you'll likely need to undergo several tests to really rule out other conditions, because symptoms of IBS are really general and they can apply to so many other illnesses. What your doctor is probably going to do is ask you a series of questions to really get an understanding of the symptoms that you're experiencing, and then they'll order several different tests. So some of these could include an endoscopy, breath tests, ultrasounds, x-rays, MRIs, maybe even a HIDA scan to rule out gallbladder issues. At least those are some of the tests that I had to undergo. When these tests don't reveal any issues, then your gastroenterologist will likely ask you to start a food journal, maybe do an elimination diet, and they might even prescribe you some medication to help manage your symptoms in the meantime. So what are the treatments for IBS? Because there's no cure for IBS, but you can definitely manage it through lifestyle changes, support, and medication. So the first thing I want to talk about is the Low FODMAP diet. So this diet was actually developed by Monash University after studying patients with IBS. The diet tends to be successful for about 80% of those who try it. When you're following a low FODMAP diet, the point is really to limit the amount of FODMAP containing foods to lessen your IBS symptoms. And we'll talk about FODMAPs later in this series. Exercise can really help someone with IBS. So in general, exercising, it just makes you feel good, right? And there are benefits of exercise for those with IBS that go beyond burning fat and toning muscle. So the endorphins that are released when exercising really tend to reduce your stress, and that can be a common trigger of IBS symptoms. So regular exercise is thought to improve your overall health and your quality of life, which can lead to a reduction in anxiety and depression, which are linked to IBS. And although the type of physical activity that you choose to do is going to fit your preferences and your abilities, yoga seems to be a favorite among those with IBS, because it's really not too strenuous like cardio or lifting weights, and it can be a good option even when your symptoms are on the rise. There's also therapy and meditation. So remember we talked about having that link between our brain and our gut? So think about it. When you're hungry, your stomach sends signals to your brain, and your brain processes those signals as hunger. In the same way, our brain can send signals to our gut too. For instance, when you get really nervous, you might feel butterflies in your stomach. That's your brain communicating an emotion to your gut, and your gut interpreting that as a physical feeling. Because of this brain-gut linkage and the fact that many people with IBS suffer from anxiety and depression, therapy and meditation may help decrease your IBS symptoms. And I also found in my research something about chiropractic care. So, interestingly enough, there seems to be a correlation between IBS and misaligned spines. Again, it all goes back to that link between our brain and our gut, or if you put it another way, our nervous system and our digestive system. So, this misalignment could cause a breakdown in communication between the two. So, people who have adjustments to correct this misalignment may actually see a reduction in their IBS symptoms. And then, of course, there's always medication. So, with any chronic illness, there's sure to be a drug to treat it, and IBS is no different. There are actually a couple of categories of medications. So, there are those that are made specifically to treat IBS, and others that are actually used to treat your IBS symptoms. Medications used to treat IBS symptoms can range from antidiarrheals to antidepressants. But you might find that your doctor steers you away from medication as a treatment for IBS unless it's absolutely necessary. And it's probably because IBS is a lifelong illness, and some of these medications really aren't meant to be taken indefinitely. Plus, there are so many other alternatives to get your IBS under control, including all the things that we just talked about. So now you know all about IBS. Join us next week to learn about FODMAPs. What the heck are FODMAPs?